His expensive perfume couldn't mask the scent of fear as her lips turned blue. Dr. Robinson stepped back, face unreadable. Harvard Medical. Top of her class. Chief of Cardiology at Westview Memorial. Yet, to this dying woman, she was nothing but her skin color. The ER nurses froze, eyes darting between patient and doctor. They'd seen this before, just never this blatant, never with a patient this critical. Westview Memorial served Boston's wealthiest families, and Patricia Whitfield was royalty here. Hospital board member's wife, seven-figure donor, legendary complainer about diversity initiatives. "Dr. Bennett," Elaine called, voice steady as she motioned to her white colleague. "Would you take over for Mrs. Whitfield?" Not a flicker of emotion crossed her face as she handed over the chart. Bennett hesitated, a flash of outrage in his eyes before professionalism took over. "Of course, Dr. Robinson." Patricia relaxed visibly as Bennett approached. Thank goodness. Someone qualified. Her breath came easier, but the monitor still showed dangerous arrhythmia. The nurses exchanged knowing glances. They'd witnessed this dance before. Elaine stepped back but didn't leave. Something about the ECG pattern troubled her. The ST elevation wasn't typical for a standard myocardial infarction. Most doctors would miss it, but Elaine had published on this exact variant last year in the New England Journal of Medicine. "Page Cardiology for a consult," Bennett told the nurse, recognizing the complexity of the case. "You're looking at cardiology," the nurse whispered. "She's the chief." Bennett's jaw tightened. He'd been at Westview only 6 months, long enough to respect Dr. Robinson's brilliance, but not long enough to navigate these waters confidently. "Dr. Robinson, would you mind consulting on this case?" he asked formally, loud enough for Patricia to hear. Patricia's eyes snapped open. "I don't want her involved, at all." The double doors burst open as a tall man in an Italian suit strode in. Harrison Whitfield, Patricia's husband and the hospital's largest individual donor, scanned the room before spotting his wife. "Patricia, what happened?" "Harrison, thank God." Patricia reached for him. "They tried to make that woman my doctor." She pointed at Elaine with a trembling finger. "I told them I wanted someone appropriate." Harrison's eyes narrowed at Elaine. "Are you the one who upset my wife during a cardiac event? Do you have any idea who we are?" Before Elaine could respond, Bennett stepped forward. "Sir, your wife is experiencing a serious cardiac event. Dr. Robinson is our chief of cardiology. I don't care if she's the Surgeon General. My wife clearly requested another physician." Harrison straightened his tie. "This hospital receives substantial support from our family. I expect our preferences to be respected." The cardiac monitor beeped faster. Patricia's condition was deteriorating while they argued. Elaine watched the numbers, calculating risk factors and treatment options. Standard protocol would be insufficient for what she suspected. "Dr. Bennett," Elaine said quietly, "a word?" She moved a few steps away, professional courtesy in every line of her body. Bennett joined her. "I apologize for their behavior," he murmured. "Not relevant right now," Elaine replied. "Look at the lateral leads on that ECG. This isn't a standard MI. She needs a specialized workup and likely immediate intervention." Bennett glanced at the monitor. "You're thinking Prinzmetal angina?" "Possibly, or a rare variant. The pattern suggests coronary vasospasm with potential genetic factors." Elaine kept her voice clinical, detached. "She needs a calcium channel blocker, not just standard protocol." From her bed, Patricia watched them suspiciously. "What are they whispering about, Harrison? I don't want that woman making decisions about my care." Harrison approached the doctors. "Is there a problem? Will Elaine walk away when her expertise could save this woman's life?" The question hung in the air as the monitors continued their urgent warnings. "No problem at all," Bennett replied to Harrison, tension evident in his shoulders. "We're discussing treatment options. Your wife presents with some complex cardiac symptoms. Elaine stepped back, allowing Bennett space to handle the Whitfields. Hospital politics were a game she'd mastered years ago, knowing when to speak and when silence served better. But patients' lives trumped politics every time. Bennett ordered the standard treatment protocol: aspirin, nitroglycerin, morphine. The nurse administered the medications while Harrison hovered, checking his Patek Philippe watch every 30 seconds. Elaine watched the monitors from across the room. Patricia's numbers weren't improving. The ECG still showed the abnormal pattern she'd spotted immediately, a subtle variation most cardiologists would miss without specialized training. "Dr. Bennett," she called softly. "The ST elevation in leads V2 through V4. You're seeing that, correct?" Bennett frowned at the screen. "Yes, consistent with anterior wall MI. We're treating appropriately." "Look at the T waves and the QT interval," Elaine persisted. "This presentation suggests coronary vasospasm with possible genetic components. Standard MI protocol won't address the underlying cause." Harrison's head snapped up. "What are you saying? That he's making a mistake?" "I'm suggesting a differential diagnosis based on specific ECG abnormalities," Elaine replied evenly. "This pattern is rare but documented. I published research on this variant last year." Patricia's breathing grew more labored. "Harrison," she gasped, "get me another doctor, someone more experienced." "Sir," Bennett said, hesitation clear in his voice, "Dr. Robinson is the most experienced cardiologist in this hospital. She literally wrote the paper on this condition." "Then have her explain it to you and step away," Harrison snapped. "My wife has made her wishes clear." The double doors swung open again as Dr. Maxwell Pierce, the hospital administrator, hurried in. Alerted by security about a disturbance involving the Whitfields, Pierce assessed the situation with the political acumen that had kept him employed through 3 hospital mergers. "Mrs. Whitfield," he said smoothly, "I'm so sorry to see you in distress. I assure you our team is providing the very best care." "That woman keeps interfering," Patricia said, pointing weakly at Elaine. "I've made it clear I don't want her involved." Pierce's smile tightened. "Dr. Robinson, may I speak with you?" He gestured toward the hallway, his message clear. Outside, Pierce dropped the smile. "The Whitfields donate $3 million annually. Is this the hill you want to die on?" "No one's dying on any hill if I can help it," Elaine replied. "But that woman might die if she doesn't receive the correct treatment. She's presenting with a rare variant that requires immediate specialized intervention. Dr. Bennett is a capable physician." "Who's been here 6 months and hasn't seen this presentation before?" Elaine interrupted. "Administrator Pierce, I understand the politics, but this is a medical emergency." Pierce sighed. "You know how these situations work, Elaine. Some patients are particular about their care providers." "You mean racist?" "I didn't say that." "You didn't have to." Elaine crossed her arms. Section 1557 of the Affordable Care Act prohibits discrimination in healthcare settings. If we allow patients to refuse care based on a provider's race— "This isn't about legal technicalities," Pierce interrupted. "It's about hospital relationships and funding. The Whitfield wing didn't build itself. And my research center won't either if I'm removed from my position," Elaine countered. "But right now there's a patient whose life depends on proper diagnosis and treatment. That trumps everything else." Will Elaine risk further humiliation to correct a diagnosis that could save Patricia's life? A crash from inside the ER interrupted them. Elaine rushed back in to find Patricia convulsing, the monitor alarms blaring. Bennett looked panicked. "She's deteriorating," he said. "BP's dropping, arrhythmia worsening. We need to move to intervention immediately." "It's the standard treatment," Elaine said, grabbing the chart. "It's triggering paradoxical vasospasm. She needs calcium channel blockers and immediate cardiac catheterization." "You're not touching my wife," Harrison shouted, even as Patricia's body jerked with seizure activity. "This is your fault. You upset her." Pierce stepped between them. "Dr. Bennett is handling this case, and the patient is coding," Elaine cut in. Dr. Bennett, do you have experience with paradoxical reactions to nitrates in vasospastic conditions? Bennett's silence was answer enough. Then step aside or assist me, Elaine said, moving to Patricia's bedside. Nurse, 30 milliliters diltiazem slow IV push. Prepare the cath lab immediately. Stop her! Harrison grabbed Elaine's arm. She's not authorized. Will Elaine sacrifice her professional integrity to protect her position at the hospital? Sir, remove your hand, Elaine said, voice deadly calm. You're interfering with emergency medical care. Dr. Robinson, Pierce warned. Administrator Pierce, Elaine replied without looking away from the monitors. You can fire me tomorrow. Right now I'm saving your donor's life. Bennett made his decision. I'm deferring to Dr. Robinson's expertise. Nurse, diltiazem as ordered. He gently moved Harrison back. Sir, please, let us work. The medication went in. For 10 agonizing seconds, nothing changed. Then Patricia's convulsions slowed. The monitors showed improving values. She's stabilizing, Bennett breathed. That was the right call. Temporarily, Elaine replied. She needs catheterization immediately to prevent recurrence. And we need genetic screening. This presentation strongly suggests an underlying hereditary component. Harrison stood shell-shocked as they prepared to move Patricia. This isn't over, he said to Pierce. If anything happens to her, your wife will receive the best possible care, Pierce assured him. Dr. Robinson is our chief cardiologist for a reason. As they wheeled Patricia toward the doors, her eyes fluttered open. Seeing Elaine directing her care, she tried to speak. I told you, don't want... Mrs. Whitfield, Elaine said professionally, you're experiencing a life-threatening cardiac event requiring immediate intervention. Hospital protocol mandates that the chief specialist takes lead in critical cases. I'll be performing your catheterization. No! Patricia tried to sit up. Harrison, don't let her! Harrison looked between his wife's pale face and the now stabilized monitors. Patricia, let's just get you stable. I'll sue, Patricia gasped at Pierce. Every member of the board will hear about this. The team continued moving toward the elevators. Elaine's hands remained perfectly steady as chaos erupted around her, her focus entirely on the medical emergency at hand. Dr. Robinson, Pierce called after her. The hospital cannot authorize this against the patient's explicit wishes. The liability... Then have her sign an AMA form and find another cardiologist who specializes in variant angina with suspected genetic etiology, Elaine replied, not slowing. Good luck with that search. The elevator doors opened. Decision time. This is a direct order, Pierce said. Stand down or face consequences. Will Elaine's colleagues support her authority or bow to pressure from wealth and power? Bennett stepped forward. I'm assisting Dr. Robinson. The patient needs immediate intervention that Dr. Robinson is uniquely qualified to perform. 3 nurses nodded in agreement, positioning themselves protectively around the gurney. Pierce looked at the unified medical team, then at Harrison Whitfield's thunderous expression. Mr. Whitfield, I suggest you come with me to the surgical waiting area. We can discuss this further there. As the elevator doors closed on Elaine and her team, the last thing she saw was Harrison Whitfield pointing a finger at Pierce, his face contorted with rage. The consequences would come later. Right now, a life hung in the balance, even if it belonged to someone who saw her as less than human. The scrub room was silent except for the methodical sound of surgical soap being worked into skin. Elaine stood alone at the sink, eyes fixed on her hands as she performed the ritual she'd done thousands of times before. Scrub for 2 minutes. Rinse. Repeat. The cool surgical steel felt familiar under her fingertips. In the polished metal surface, her reflection showed determination hardening in her eyes. For this brief moment of solitude, she allowed herself to feel the weight of what was happening. 20 years of medicine. 14 papers published. 3 breakthrough procedures developed. Yet still, patients looked at her and saw only color. Colleagues looked at her and saw a quota filled. Administrators saw a liability and an asset, depending on which press release they were drafting that week. And what did she see? A doctor. Nothing more, nothing less. The door swung open as Bennett entered, breaking her reverie. Cath labs prepped, patients stable but still critical. He began scrubbing at the sink beside her. Pierce is having a meltdown in his office with Whitfield. Legal's been called. Of course they have. Elaine's voice remained neutral. She'd learned long ago that showing anger only reinforced stereotypes. Showing hurt made her vulnerable. Neutrality was armor. You know they could pull your privileges for this, Bennett said quietly. Whitfield's threatening everything from a lawsuit to calling the governor. I'm aware. Then why? Because she'll die otherwise. Elaine finished rinsing. Her presentation is textbook for the variant I documented last year. Standard intervention will fail, possibly catastrophically. Bennett studied her. There are other cardiologists. None who would recognize this in time. She met his gaze. Would you let a patient die to protect your career? The question hung between them, unanswered. Elaine closed her eyes briefly, the weight of constant calculation exhausting her. Every decision measured not just by medical standards, but by the additional metrics applied only to her. Work twice as hard. Be twice as good. Make no mistakes. Show no emotion. Navigate politics. Break no rules. Save lives without ruffling feathers. Today, feathers would be ruffled. Her mind drifted to a memory she rarely allowed herself to revisit. She was 12. Sitting beside her grandmother's hospital bed in rural Georgia. Grandma May, the backbone of their family, breathed laboriously while a dismissive doctor barely glanced at her chart. Just age and obesity, he'd said. Nothing to be done. But Grandma May, herself a midwife for 40 years, had squeezed young Elaine's hand and whispered, "Listen to my heart, child, the way I taught you." Elaine had placed her ear to her grandmother's chest, hearing the distinctive murmur that the doctor had missed. When she tried to tell him, he'd patted her head and left the room. By morning, Grandma May was gone. Aortic dissection, the autopsy revealed. Completely treatable if caught in time. On her deathbed, Grandma May had held Elaine's hand. "They'll never see your value until they need what only you can give," she'd said. "Be ready for that moment." The memory dissolved as Bennett spoke again. "Legal will ask if you considered other options." "I've documented everything," Elaine replied, extending her arms as a surgical nurse approached with a sterile gown. The patient presented with variant Prinzmetal angina with suspected genetic factors. Standard protocol caused paradoxical vasospasm. Immediate intervention is medically necessary. All by the book. And if they claim you overrode the patient's right to choose her provider? Patient autonomy doesn't extend to discriminatory practices in emergency situations, Elaine recited. Section 1557 of the ACA is clear. So is my ethical obligation as the most qualified physician present. She nodded to the nurse to tie her gown. But yes, there will be consequences. 10 years building her reputation at Westview. The research center she'd fought for, finally approved last quarter. All potentially gone after today. Another hospital, another city, starting over again. The familiar weight of being the first and the only settled on her shoulders. How many times could one person pioneer the same path? "Dr. Robinson?" A different nurse appeared at the door. "They're asking for your decision on the approach." Here was the crossroads. Standard procedure would be defensible but potentially ineffective. The variant Whitman procedure she'd pioneered during her fellowship would be more effective but would further antagonize hospital politics, using an innovative approach on a litigious patient without consent forms signed. Medical excellence versus career preservation. The calculation every marginalized physician made daily, amplified to life or death stakes. Bennett watched her, his expression betraying his own calculation. Support the best doctor he'd ever worked with or protect his promising career. "What's your call?" he asked quietly. Elaine thought of Grandma May, of the countless patients who'd rejected her care over the years, of Patricia Whitfield's disgusted expression, of the oath she'd taken when receiving her medical degree. "Prepare for variant Whitman procedure," she said, voice steady. "I'll lead." The scrub nurse's eyes widened slightly. The Whitman was rare, complex, and in this hospital performed only by Dr. Robinson. "Are you sure?" Bennett asked. "That's going to be hard to defend to the board." "I'm not here to defend decisions to the board," Elaine replied, moving toward the door. "I'm here to save lives." As they walked toward the operating room, Elaine felt a strange calm descend. Whatever came after, career implosion, lateral transfer, legal battles, would be tomorrow's problem. Today, she was simply a doctor doing what she'd been trained to do. Through the observation window, she caught sight of Harrison Whitfield and Administrator Pierce watching, their faces masks of controlled anger. Beside them stood the hospital's legal counsel, already taking notes. Elaine turned away from them, focusing instead on the surgical team awaiting her direction. "Everyone who's staying, gown up," she said clearly. "Everyone who's leaving, do it now." Not a single person moved toward the door. The operating room hummed with focused energy. Monitors beeped steadily as Elaine guided her team through the complex procedure. Her voice remained calm, clear, and precise, the voice of absolute expertise. "Advancing catheter through the femoral artery now," she stated. "Nurse Jenkins, prepare the contrast medium." Through the observation window, Harrison Whitfield paced, while Pierce and the hospital attorney, Sarah Greenberg, spoke in hushed tones. They'd been unable to stop the procedure once it began. The risks of interrupting were too great to justify legally. "Reaching the coronary arteries," Elaine announced. "Let's get a clear image." The screens displayed Patricia's heart, the contrast medium illuminating the vessels. Elaine studied the images intently, her suspicions confirmed by what she saw. "Classic presentation of variant vasospasm," she noted for the record. "Arterial constriction triggered by standard nitrate therapy, consistent with my 2023 paper. Beginning specialized vasodilation sequence." Bennett watched in quiet awe as Elaine performed the procedure she'd pioneered. Her hands moved with certainty, each motion deliberate and precise. This wasn't just technical skill, this was artistry. "Initiating Whitman technique," she said. "Modified calcium channel approach with localized delivery." The room fell silent except for the steady beep of monitors. The technique required perfect timing and precision. Any error could trigger catastrophic vasospasm. Elaine's hands remained perfectly steady, her focus absolute. This was the moment she lived for, when all that mattered was the medicine, the science, the healing. No politics, no prejudice, no barriers. Just a doctor doing what she was born to do. "First phase complete," she announced. "Vascular response is positive. Proceeding to secondary intervention." In the observation room, even Harrison had stopped pacing, his eyes fixed on the monitors. Whatever his personal feelings, he couldn't deny the skill he was witnessing. "Dr. Bennett, note the structural anomaly at the left anterior descending artery," Elaine said, indicating a section of vessel. "That's not typical atherosclerosis." Bennett leaned closer to the screen. "Congenital malformation?" "Possibly." Elaine studied the image. "But the pattern suggests something specific. I want a tissue sample for genetic analysis." The procedure continued for another 47 minutes, Elaine working methodically to stabilize Patricia's condition. As she completed the final steps, the tension in the room eased. The monitors showed strong, regular heartbeats. Blood pressure stabilized. Oxygen saturation returned to normal. "Procedure complete," Elaine announced. "Patient is stable. Excellent work, everyone." As the team began post-operative protocols, Elaine made her final notes for the record. Patient to receive specialized follow-up and genetic screening. Standard recovery protocol with modified medication regimen as outlined in my notes. Bennett approached as she finished. That was remarkable, he said quietly. I've never seen the Whitman performed live before. Now you have, Elaine replied, signing the chart. You should learn it. There aren't enough of us who can perform it when needed. Dr. Robinson, a nurse called from the doorway. Administrator Pierce requests your presence in his office immediately. Of course he does. Elaine handed the chart to Bennett. Monitor her recovery closely. The genetic screening results will be critical for her ongoing care. What do you suspect? Bennett asked. Elaine paused. Something that will make this case even more complicated than it already is. Pierce's office felt like a war room. Harrison Whitfield sat rigidly in one chair while Sarah Greenberg reviewed documents. Pierce himself stood by the window, his back to the door when Elaine entered. You directly violated a patient's explicit wishes, Pierce began without turning around. You ignored a direct administrative order. You performed an experimental procedure without consent forms. I performed a life-saving intervention using an established technique published in peer-reviewed journals, Elaine corrected, remaining standing. The patient is stable and will recover fully because of that decision. Harrison turned to her, face flushed. My wife made her preferences clear. You had no right. Mr. Whitfield, Elaine interrupted calmly, your wife presented with a rare and life-threatening cardiac condition that required specialized knowledge to identify and treat. Without the intervention she received, she would have suffered permanent heart damage or death. That's your claim, Harrison snapped. Convenient that only you could supposedly save her. The medical records will speak for themselves, Elaine replied, as will the testimony of the surgical team. Pierce finally turned from the window. The board is convening an emergency session tomorrow morning. Until then, you're suspended from clinical duties. Elaine had expected this. I understand. This isn't just about today, Pierce continued. You've been difficult about hospital politics for years, always pushing boundaries, challenging decisions, advocating for better patient care, Elaine finished. Yes, guilty as charged. Harrison stood, straightening his suit jacket. My family has supported this hospital for 3 generations. We expect certain courtesies in return. Like the courtesy of ignoring medical best practices based on racial prejudice? Elaine asked mildly. That's outrageous, Harrison sputtered. This has nothing to do with... Mr. Whitfield, Sarah Greenberg interjected. I advise against continuing this discussion. She turned to Elaine. Dr. Robinson, the hospital is investigating this incident fully. Will require your complete documentation. You'll have it, Elaine assured her, including the genetic screening results, which should be quite illuminating. Pierce frowned. What genetic screening? The tissue sample taken during the procedure, Elaine explained. Mrs. Whitfield's condition strongly indicates a hereditary component. Proper follow-up care requires genetic analysis. Harrison's face darkened. You took genetic samples without consent? That's a violation of standard medical protocol for this presentation, Elaine finished. The consent for emergency cardiac intervention covers necessary diagnostic procedures. Sarah Greenberg made a note. We'll review the consent forms. While you're doing that, Elaine added, you might want to review the hospital's non-discrimination policies as well, and perhaps refresh your understanding of Section 1557 of the Affordable Care Act regarding patient discrimination against providers. The tension in the room thickened. Everyone present knew Elaine was right, legally, if not politically. You're dismissed, Dr. Robinson, Pierce said finally. The board will determine next steps tomorrow. Elaine nodded and turned to leave, then paused at the door. Sometimes the hands that save you are the ones you refuse to hold, she said quietly, before walking out. Patricia Whitfield woke slowly, the fog of anesthesia lifting gradually. The steady beep of monitors oriented her before she opened her eyes. Hospital. Cardiac event. Surgery. When her vision cleared, the first face she saw was Elaine Robinson's. "No," Patricia croaked, instantly agitated. "I told them not you." "Mrs. Whitfield," Elaine said professionally, "I'm performing a standard post-operative assessment. Dr. Bennett will be here momentarily." Patricia tried to sit up, wincing at the pain. "You were explicitly told to stay away from me. Where's Harrison? Where's Dr. Pierce?" "Your husband is speaking with administration," Elaine replied, checking the monitors. "Your vital signs are stable. The procedure was successful." "Procedure?" Patricia's eyes widened. "You performed surgery on me? After I specifically refused?" "You experienced a life-threatening cardiac event requiring immediate specialized intervention," Elaine explained. "As chief of cardiology, hospital protocol required my involvement." "That's assault," Patricia hissed. "You had no right to touch me." "Mrs. Whitfield, I want another doctor, now." The door opened as Bennett entered with Harrison. Harrison rushed to Patricia's side, taking her hand. "Patricia, thank God. How are you feeling?" "She operated on me, Harrison," Patricia said, voice trembling with anger, "after I explicitly said no." Harrison's jaw tightened as he glared at Elaine. "The hospital is addressing this breach of protocol. Dr. Pierce has already suspended her." Bennett cleared his throat. "Mrs. Whitfield, I was present during the procedure. Dr. Robinson's intervention saved your life. The technique she used was one very few cardiologists can perform successfully." "Anyone could have figured that out," Patricia dismissed. "She just pushed her way in because she has something to prove." Elaine remained professional, though her patience was wearing thin. "Mrs. Whitfield, your case presented with several unique factors requiring specialized knowledge to identify and treat correctly. Standard protocol would have been ineffective, possibly fatally so." "So you claim," Patricia scoffed. "The medical record speaks for itself," Elaine replied. "But more importantly, we discovered something during the procedure that affects your ongoing care. Your condition has a genetic component that requires additional treatment and monitoring." Patricia frowned. "What are you talking about? There's no heart disease in my family." "The genetic markers aren't just about cardiac health," Elaine explained carefully. "They reveal a hereditary condition that affected how your body responded to standard cardiac medications, a condition with specific demographic associations." Harrison stepped closer. "What demographic associations?" Elaine met his gaze steadily. "The genetic markers we identified are strongly associated with individuals of West African descent." The room went silent. Patricia stared at Elaine, comprehension slowly dawning on her face, followed by disbelief. "That's absurd," she finally sputtered. "I'm from one of Boston's oldest families. My ancestry is entirely European." "Genetics don't lie, Mrs. Whitfield," Elaine said gently. "The specific markers we identified are present in approximately 0.8% of people with exclusively European ancestry, but 27% of those with West African heritage." "You're making this up," Patricia accused, her voice rising. "This is some kind of revenge, some sick joke." Bennett intervened. "Mrs. Whitfield, I've reviewed the results myself. The findings are conclusive." "I want another test," Harrison demanded. "From a different lab, a different doctor." "Of course," Elaine agreed. "That would be standard protocol for confirming these results. But you should know. The genetic profile explains why standard cardiac interventions would have failed in your case. Without recognition of this factor, future cardiac events could be fatal." Patricia's face had gone ashen. "Get out," she whispered. "Get out of my room." Elaine gathered her notes. "Dr. Bennett will continue your care. I've left detailed instructions for your follow-up treatment, including the modified medication protocol necessary given your genetic profile." As Elaine walked to the door, Patricia called after her, voice shaking. You fabricated those results. I'll have every test redone. I'll sue you personally. Elaine paused at the doorway. Mrs. Whitfield, I understand this is difficult information to process, but your health depends on acknowledging these facts. I'd recommend the same genetic counseling I recommend to all my patients with hereditary factors. You haven't heard the last of this, Harrison warned. The board will have your license. Elaine met his gaze without flinching. The board will have my detailed report, including how racial bias nearly resulted in catastrophic medical error. I wonder which story they'll find more concerning. She left the room, hearing Patricia's angry sobs behind her. The truth had dropped, and the aftershocks were just beginning. The hospital boardroom buzzed with tension 3 days later. Every seat at the mahogany table was filled. Board members, department heads, legal counsel. Elaine sat alone at one end, a stack of documentation before her. At the opposite end, Administrator Pierce conferred quietly with the board chairman. The double doors opened. Harrison Whitfield entered, his usual commanding presence diminished by obvious exhaustion. Whispers rippled through the room as people noted his arrival without Patricia. Mr. Whitfield, the chairman acknowledged. We weren't expecting you today. This meeting concerns my family directly, Harrison replied, taking a seat. I intend to be present. The chairman nodded. Very well. Then let's begin. He shuffled papers importantly. We're here to address the incident involving Dr. Elaine Robinson and her treatment of Patricia Whitfield against explicit patient wishes. Dr. Pierce has recommended termination of Dr. Robinson's position and clinical privileges. Murmurs filled the room. Several department heads exchanged concerned glances. Before we proceed, the chairman continued, our legal counsel has prepared an analysis of potential liability issues. Sarah Greenberg stood. After reviewing all documentation, I must advise the board that Dr. Robinson's actions, while procedurally questionable, were medically justified under emergency provisions. The case would be defensible if litigated. Pierce frowned. The patient explicitly refused treatment from this specific doctor. That creates clear liability. Not necessarily, Greenberg countered. Section 1557 of the Affordable Care Act prohibits discrimination against healthcare providers based on race. If we establish a precedent that patients can refuse treatment based on a doctor's race without medical justification, we open ourselves to significant legal exposure. The boardroom fell silent as this sank in. Elaine spoke for the first time. If I may address the board? The chairman nodded reluctantly. This incident reflects a larger pattern, Elaine began, opening her folder. Over the past 5 years, I've documented 47 cases where patients initially refused treatment from me or other minority physicians without medical justification. In 39 of those cases, the hospital administration accommodated these requests without question. She slid copies of her documentation toward the center of the table. This represents not only a violation of Section 1557, but a systemic failure to support qualified physicians who happen to be minorities. Pierce leaned forward. Dr. Robinson, are you suggesting you've been compiling a case against this hospital? I'm suggesting I've been documenting a pattern that puts patients at risk, Elaine corrected. When the most qualified physician is prevented from treating a patient due to prejudice, patient outcomes suffer. Mrs. Whitfield's case demonstrates this reality dramatically. The cardiology department head cleared his throat. For the record, Dr. Robinson is the only physician at Westview qualified to perform the Whitman procedure. Her intervention saved Mrs. Whitfield's life. A life she wouldn't have needed saving if Dr. Robinson hadn't upset her in the first place, Pierce countered. That's not accurate, Bennett interjected from his seat near the middle of the table. Mrs. Whitfield's condition was critical upon arrival. The genetic factors Dr. Robinson identified would have made standard treatment protocols potentially fatal, regardless of who administered them. Harrison Whitfield had remained silent, his expression unreadable. Now he straightened in his chair. May I speak? The chairman nodded, surprised. My family has supported this hospital for 3 generations, Harrison began, his voice lacking its usual force. In that time, we've expected certain considerations in return. Perhaps too many. A shocked silence fell over the room. Mr. Whitfield, Pierce started. Harrison held up his hand. Patricia is recovering well. The follow-up genetic testing confirmed Dr. Robinson's findings. He paused, the admission clearly difficult. All of them. The clock on the wall ticked loudly in the silence. We've consulted 3 independent specialists, Harrison continued. All confirmed that without the specific intervention Dr. Robinson performed, Patricia would have suffered severe damage or death. And all confirmed the genetic markers indicating African ancestry. Elaine kept her expression neutral, though this public admission surprised her. The Whitfields had built their identity on their pure Boston Brahmin lineage for generations. Patricia won't be joining this proceeding, Harrison added. She's processing this information with professional help. The chairman cleared his throat. Mr. Whitfield, are we to understand that you're not pursuing action against Dr. Robinson or the hospital? On the contrary, Harrison replied. I'm here to ensure the board understands exactly what happened. He turned to face Elaine directly. Dr. Robinson identified a life-threatening condition others missed. She persisted despite opposition from the patient, the administration, and me. She performed a procedure few physicians can execute, and she saved my wife's life. The boardroom remained silent, the tension shifting palpably. I'm alive because Dr. Robinson ignored my prejudice, came a voice from the doorway. All heads turned to see Patricia Whitfield standing there, pale but composed. She entered slowly, taking a seat beside her husband. Patricia, Harrison murmured, surprised. You said you weren't coming. I changed my mind. Patricia's voice was tight but controlled. Some things need to be said in person. She faced the board, her aristocratic bearing intact despite her obvious discomfort. I rejected Dr. Robinson based solely on her race. I was wrong to do so, and I nearly died as a result. The boardroom remained absolutely still. Even Pierce seemed stunned by this turn of events. The genetic results have been difficult to accept, Patricia continued. They challenge everything I believed about my family history. But facts don't care about my beliefs. She turned to Elaine, meeting her eyes directly for perhaps the first time. I don't like you, Dr. Robinson. I probably never will. But you saved my life when you had every reason not to, and you discovered a truth about me that, however uncomfortable, I needed to know. The wall clock ticked 7 times before Patricia spoke again. This hospital should not be punishing excellence to protect prejudice, she finished. If the board terminates Dr. Robinson, the Whitfield family will withdraw all financial support immediately. The chairman's mouth actually fell open. Mrs. Whitfield, you can't mean... I've never been more serious, Patricia replied. Sometimes truth is a bitter medicine, but that doesn't make it less necessary. Harrison placed his hand over his wife's. This small gesture, the solidarity in facing a shattered worldview, spoke volumes. The boardroom filled with the low murmur of urgent conversations. Pierce looked shell-shocked. The chairman conferred hurriedly with legal counsel. Through it all, Elaine remained composed, her expression revealing nothing of her inner thoughts. The tide had turned, but the waters remained dangerous. 3 months later, Elaine stood at the podium in Westview's newly renovated auditorium. Behind her, a banner proclaimed, Westview Center for Equitable Healthcare, Inaugural Symposium. The audience, medical professionals, administrators, and community members, filled every seat. Medicine at its core is about truth, Elaine began. The truth of the body, the truth of science, and sometimes the harder truths about ourselves and our systems. In the front row, Dr. Bennett nodded encouragingly. Beside him sat Administrator Pierce, whose chastened demeanor reflected the institutional changes of recent months. The case that catalyzed this center taught us something essential, Elaine continued. Truth lives in the body, even when the mind denies it. The doors at the back opened quietly as Patricia Whitfield slipped in, taking a seat in the last row. She looked different, less rigid, her expensive clothes simpler. The genetic counseling sessions had clearly left their mark, changing more than just her understanding of her medical history. In the 3 months since implementing our new protocols, Westview has seen a 28% improvement in outcomes for minority patients, Elaine noted. That's not just a statistic. That's lives saved, complications prevented, and families kept whole. The changes had come swiftly after the board meeting. The hospital had adopted blind initial patient assignments. A robust bias reporting system had been implemented. Most significantly, the diversity initiative Elaine had proposed years earlier had finally received full funding, ironically from the Whitfield Foundation. Medical bias isn't always deliberate, Elaine acknowledged, but its consequences are always real. By implementing structural changes, we address the problem regardless of intent. From her seat, Patricia watched the woman she had once rejected. Their relationship would never be warm. Too much had happened for that. But respect had replaced contempt, and that transformation itself was a kind of healing. Harrison had stepped down from the hospital board, focusing instead on restructuring the family foundation to support medical equity initiatives. Their marital therapist called it growth through crisis, the painful reconstruction of identity after fundamental truths were revealed. Healing happens in stages, Elaine concluded. First the body, then the systems that care for it. This center represents our commitment to both. As applause filled the auditorium, Elaine caught sight of the new wing's sign through the window. The Robinson Center for Medical Equity. Not the legacy she had imagined, but perhaps the one that mattered most. After the presentation, audience members gathered in small groups, sharing experiences. The conversations were sometimes uncomfortable but always necessary. Real-life stories of medical bias faced by patients and providers alike. Patricia remained in her seat until the crowd thinned. When she finally approached Elaine, their exchange was brief but significant. "The genetic counseling has been illuminating," Patricia said simply. Elaine nodded. "I'm glad you continued with it." "Some family histories are more complicated than others," Patricia replied. A pause, then, "Thank you for everything." As she walked away, Elaine reflected on the journey that had brought them here. From rejection to life-saving, from revelation to transformation. Not a perfect ending, but a true one. That moment when truth shatters prejudice changes everything. Has a powerful story like Dr. Robinson's ever moved you to see the world differently? If this story touched your heart, don't keep it to yourself. Hit that like button to help others discover it too. Want more powerful real-life stories that expose truth and inspire change? Subscribe to Beat Stories now. We deliver the most compelling Black stories, touching narratives, and transformative life stories that will keep you coming back for more. Comment below with your own experiences facing bias or standing up for what's right. Your story might be exactly what someone else needs to hear today. Truth lives in the body, even when the mind denies it. Join our Beat Stories community, where truth is always worth fighting for.